So you're about 10 weeks pregnant and your doctor wants you to come in for a blood test called an NIPT. What is it and what are we testing for? So the NIPT is a blood test where they take the mom's blood, and in that blood they have, believe it or not, this is going to sound almost science fiction, there's fetal cells from the placenta that are circulating through the mom's bloodstream, and those cells are able to be tested to see if there's anything wrong with your baby. Usually at around 9-10 weeks, or about 3 to 13% of those cells are from the baby. They take those cells and they're able to test for a few things. They are able to test for the 3 most common aneuploidies, which are Down syndrome, Edwards syndrome, and Patau syndrome, which end up being trisomy 21, 18, and 13. You're able to check the sex chromosomes to know if it's a boy or a girl, and to know if there's any issues with those sex chromosomes. Why do we wait till about 9 to 10 weeks? In our practice, we do 10 weeks because we want to make sure there's enough of that fetal fraction to be able to get good results. Sometimes, if there's not enough of a fetal fraction, we're not able to get a result. And the most common one is, believe it or not, too early in pregnancy. There could also be other things like medications that you're taking. There could be issues with mom's genetics. If, for example, if the mom has a high BMI, there's a chance that a fraction of the cells end up being lower, which can affect the results. A new test that is now done in some labs, such as Natera, is they're able to get something called the RH factor from the NIPT. And that is very helpful and interesting at this moment because there's currently a shortage in RhoGAM, which is basically a vaccine given to moms with negative blood to stop the mom from seeing the baby's blood type. That blood test will allow us to know the type of blood that the baby has, which could help identify which babies have positive or negative blood, and if the baby is negative, not give a vaccine to moms that don't need it. It's important to note that the NIPT, although it is a very good test, it is very sensitive and very specific, it is still a screening test, and all moms should be offered diagnostic testing, though it has greatly decreased the amount of diagnostic testing such as amniocentesis that used to be done. For example, if you are 35 years old, your risk of Down syndrome is about 1 in 250. With this test, your risk goes down to less than 1 in 10,000 if it's negative. So it has really changed the way we do testing in pregnancies.